Fluffy and I are packing my bag and getting ready for going to surgery tomorrow. The time I have to arrive at the hospital is 9 in the morning, and then 10:30 is the surgery on the 12th of July. And I was given this whole big booklet of things to know and things to do from Dartmouth and a CD and so forth. A lot of it I could skip because it was things like improve your diet, stop smoking, I don't smoke. But for those of you who want to prepare, yes, it's good to stop smoking, to cut back on meat protein, to stop 2 weeks before surgery with any kind of blood thinner such as vitamin C or garlic, and have a meal the night before, but more than likely you'll have to stop eating solid foods, say midnight the night before. I have been taking special herbs to prepare for this surgery for some time, and the ones that I'm stressing now are, in the last few days, are Enhance, which is from Health Concerns, a combination of herbs for prevention and treatment of chronic infections, bacterial infections, the main ingredient being Ganoderma mushroom and Isatis, and natural herbal antibiotic. And taking maybe 3 to 6 a day of those, just to build myself up. And Yunnan Payo. Now, if you want information on taking Yunnan Payo before surgery, as they do in China, the best source of information is Institute of Traditional Medicine Online, itmonline.com. It's a research organization in Portland, Oregon. They are the most up-to-date with their research, and they know what's happening in China. And I based my dosage of Yunnan Payo, this combination of herbs that stops bleeding and hemorrhaging and bruising and pain from injury and from surgery. I based my dosage on what was recommended for prostate surgery, because although I'm not having prostate surgery, it's a very deep surgery. This is most effective to stop internal bleeding for lung wounds and gastrointestinal wounds. So for the 3 days prior to surgery, I'm taking 3 pills twice a day of this to help prevent excess bleeding. Now, this is not recommended or even known by the traditional medical community. And the day of surgery and thereafter, I will stop taking Yunnan Payo because I don't want to interfere with their blood thinning drugs that they will be giving me. Since hip replacement surgery is a major surgery done in this country, over 600,000 a year knees are replaced, and over 300,000 hips are replaced each year. This is a very important information for those people who are faced with joint replacement surgery. And that applies to not only baby boomers, but to runners and golfers and dancers and people who sit on their chair all day and don't exercise, because the muscles that we need to exercise to prevent joint damage, especially lower back and hips and knees, are the lower back muscles and the thigh muscles, and we don't exercise those. Not normally. There's no way we can exercise them. In my book, Naturally Pain-Free, I have a couple of exercises that I have shared, and they're very simple. So the thing to do to prepare for surgery is to improve your diet, calm and focus your mind, take some herbs for prevention of injury and building your immunity and your strength, and then make sure that you find out as much information about the surgery as you can, and about the staff, the hospital, who will help you. In my case, I'm going to be given a special medicine against MRSA, the staph infection that's very common in hospitals and is more and more common in the community now. It's a staph infection that you get either from the skin or internally. And we are fast approaching a time when antibiotics will be outdated because their effectiveness will no longer be useful. We will have to protect ourselves with the kinds of remedies that germs do not recognize, not modern antibiotics, but foods and herbs and ways to naturally build our defenses. So good luck to you.